Hi, I'm Jim Phelps, a psychiatrist. For over 25 years, I've focused on the full spectrum of mood problems, from plain depression to bipolar disorders. And you're here because you or your treatment team are looking for help figuring out what kind of depression do you have. So in a moment, I'll invite you to look at 3 5-minute videos I hope will help. Because figuring out mood problems is not simple. In the first video, you'll see that mood diagnoses like major depression are not clear-cut. There's no clear dividing line between any of the labels shown here. In the second video, you'll see that symptoms like low energy are not the only way to figure out what you have. And in the third video, we'll look at depression that's not just feeling blah, not down or up. There's depression mixed with anxiety or irritability or terrible insomnia. And so you'll see there are other more complex depressions. After viewing these 3 short videos, I hope you'll have a sense about whether you need to learn more about maybe the treatment approaches for those more complex depressions. If so, you'll see that there's more to the story here as well. First, treatment is not just pills. And second, if you need pills, they're not necessarily really scary ones. And third, antidepressants are not the main ingredient for some kinds of depression. Now, where on this spectrum of depression are you? You might have depression due to severe stresses or some really bad things that have happened to you recently or long ago. If you have that kind of depression, this video series is not really for you, but you can have trauma or severe stresses and have a more complicated depression. So stick with me for a bit here. Because you could be over here, not bipolar, but not plain depression either. Treatment for this part of the mood spectrum is not the same as for simpler depressions. Yes, there's work to do on changing ways of thinking or behaviors that make depression worse, and a therapist or a treatment program for this can help. But whether to take an antidepressant, that's not clear. Because over at this end of the mood spectrum, antidepressants can make things worse. So it's important to know, what kind of depression do you have? Well then, welcome to this video series. I hope it proves useful to you.